Hi, Steve Lynch, licensed massage therapist, and I am rocking out another day at Limestone Therapeutic Massage here in beautiful Newark, Delaware. Thank you for watching, and good morning, good afternoon, or good evening, depending upon when you're watching this. My subject for today is deep tissue massage. Now, what is deep tissue massage and how is it relative to massage therapy? Well, let me explain. See, the two words together, deep and tissue, seem fairly innocuously simple, but are they? Let's explore. Okay, so deep usually means more than light, more than moderate, more than shallow. So deep means that we're going deep, 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 like deep undercover and stuff, right? Okay, tissue, and we're not just talking about no Kleenex right here, okay? We're talking about deep and tissue relative to the human condition. So tissue would be human tissue. So if we put those two words together, deep tissue relative to the human condition, it means that there's going to be some pressure. Yeah, not pressure like at a job, but implied pressure from another being to your tissue. Now, deep tissue massage can be relative to a lot of different techniques in massage. For instance, let's talk about Swedish massage. Now, most people, when they get Swedish massage, they usually go to one of their beautiful little day spas or salons, and they get this nice, fluffy treatment from this wonderful, talented therapist who's going to sedate them into a foggy sleepiness that is euphoric in nature. And we like those kinds of wonderful Swedish massages. Okay, but Swedish massage, European in origin, was actually designed as a restorative type of work to joint capsules and tendons. Okay, so Swedish massage can also be deep tissue, which means that we're going to be uh, manipulating soft tissue. Okay, now chiropractors kind of own the word manipulation, but it also applies to people such as neuromuscular therapists, medical, clinical, orthopedic massage therapists, in that the body is filled with connective tissue such as fascia and tendon and ligament, which we're not going to be stretching any ligaments because if you do that, um, you has caused a problem. Okay, so forget the word ligaments as far as manipulation goes, but soft tissue manipulation usually implies that there's some deeper tissue work going on to the tendon, to the muscle belly, and to the fascia. Okay, so those are three important words: tendon, muscle belly, and fascia. They are all involved in deep tissue because what we want to do when we work with deep tissue, we want to affect a meaningful and beneficial change to your human condition. Let's say, for instance, that you come in and you have a slightly frozen up shoulder. Now, there is a condition called frozen shoulder, and that's a little bit different. But let's just say you've got a little sticky point in raising your arm, and it's painful, and you can't quite reach up like you need to. So there's certain muscles and tendons and connective fascia that may be involved in um, hampering that movement in your shoulder. Well, if we're going to do deep tissue, okay, that's going to involve getting in there and maybe stripping some yellow collagen fiber off the tendon sheaths. Okay, we're going to be also stripping and elongating the muscle belly. Okay, the muscle fiber. It's directional. It has direction. It has length. It's pliable and it stretches and it contracts. And it needs to be able to do all of these things inside the fascia. So we as deep tissue therapists will be working with all of those aspects and we're going to be creating beneficial change to your abilities to move with pain-free range of motion. Okay, so in a nutshell, deep tissue is not a relaxational thing. Deep tissue is a restorative technique or a restorative modality that can be utilized in any type of massage, whether that be a hot stone treatment or a Swedish treatment or any other type of massage therapy. Okay, so it's not really the type of massage, but deep tissue is really about the technique. And we could call it pressure relative to a length of excursion. Now that's like a lengthy kind of thing, but it's an actual part of terminology in massage. Deep tissue is relative to the pressure applied in any given length of excursion. In other words, if we travel on your skin this far, the depth of excursion, okay, how far in we go, that is the depth during the length of excursion across your skin. And that's all relative. So this is Steve Lynch saying, think about whether you want restorative work or you want sedative work, because those two terms are really important when you go to think about regular massage or deep tissue. Okay, deep tissue is exactly as the name implies. It's deep against the tissue of your body, and it's repairing or restorative in nature compared to a beautiful light, fluffy, spa-oriented Swedish type of work or another kind of sedative work. And I hope this answers the question about deep tissue massage.